When people think of nursing, they often picture what they see on TV or social media. Glamorous doctors and nurses saving lives in Grey's Anatomy, dramatic cases in The Good Doctor, funny, light-hearted skits from Nurse John on TikTok, or the glossy poster from Care to Go Beyond. This paint a picture of nursing as exciting, glamorous, even noble all the time. But the truth, especially here in Singapore, is very different.
I am tired on how they portray nurses because my patient said this to me today. Why are you doing the doctor's job? I was like, what are you talking about, the doctor's job? And she was like, doing my IV, getting my labs, doing my vitals, helping me to the bathroom, helping me eat.
I knew early on what nursing looked like. My grandfather was warded many times, and I saw firsthand what nurses actually did. So I didn't come in thinking it would be glamorous, but many students do. They imagine action-packed attachment filled with drama and excitement. What they find instead is heavy theory in school, long hours of studying, stress from exams, and competition, especially with international scholarship students. Nursing education isn't just about compassion, it is also about discipline, resilience, and a lot of textbooks. Many people don't realize how intellectually demanding nursing is. We study pharmacology, anatomy, physiology, microbiology, psychology, and ethics, often all at once. Every theory we learn could mean the difference between safety and harm for a patient. It's not just about having a kind heart, it's about being competent, accurate, and accountable in every action that we take. Then comes clinical attachment. Media show nurses rushing into emergencies, always in the spotlight. The reality? It's the routine. Taking vital signs, charting intake and output, turning patients, feeding, hygiene care. These tasks may seem mundane, but they are the backbone of nursing care. And of course, attachments are not filled with constant praises. You will face scoldings from seniors when things aren't done right, or even from patients who are unwell and lash out. In this moment, you are as helpless as they are, but you still have to stand firm and care for them. Nursing also tests your patience in ways you can't imagine. There are days you're stretched thin, one patient after another, endless documentation, and the constant ringing of call bells. You want to do your best for everyone, but sometimes you feel like you're barely holding it together. Yet somehow, you push through because walking away is never an option. And then there's burnout, the part nobody likes to talk about. In school, you push through sleepless nights studying for exam. In the ward, you handle heavy workloads, long shifts, and emotional strain. You give so much of yourself to others that sometimes there's little left for you. Burnout in nursing is real. Not because we don't care enough, but because we care deeply every single day. It's the side of nursing that never makes it into the dramas or the TikTok, but every nurses know it well. Death and dying hit the hardest. Media rarely shows this side, the quiet, heavy reality that not every patient makes it. As a nurse, you learn to accept that when there's life, there's death. And that's part of our job is to walk with patients and family through that journey. It's emotionally demanding in ways no drama can capture. But it's not all scolding and stress. There are quiet, meaningful moments that stays with you, like when a patient waves goodbye at discharge. And weeks later, when they recognize you outside the hospital and wave hello. They don't always remember your name, but you remember how you made them feel when they were at their lowest. This is nursing. This is the part that the TV shows and campaign don't capture. We don't get dramatic background music or applause when things goes right. Most of the time, our best work goes unnoticed. But that's the nature of nursing. The small, quiet victories that no one sees yet mean everything to someone else. So, to anyone thinking of nursing, know this. It's not Grey's Anatomy, it's not TikTok comedy, and it's not always the smiling poster. It's demanding, both physically and mentally. Burnout is real. But if you're ready for the truth, the mundane routine, the tough scolding, the emotional load, then you'll also be ready to see the quiet meaning in the work. Nursing may not be glamorous, but it is essential and it is real.